This is Jerry Hesch, and I'm filming a very painful, limited foot and ankle on the right. Marissa just had bilateral bunion surgery, severe bunions on both sides, which greatly limited her activity. Surgery was in June, and 3 months later she started to resume activity, and noted that wearing Birkenstocks was very painful back here. Tried hiking boots, they were horribly painful out here. Just was never able to progress her activities without pain. She's seen several healthcare practitioners, chiropractor, acupuncture, 2 different PTs, has had about 20 physical therapy visits. Her concern is that the focus of PT seems to vary day to day. They find a hypomobility, such as in the cuboid, and seem to gain some mobility, and then the next visit focus on something else, and so on. She feels like she can't find the ground appropriately with the first toe, and also with her ankle. She feels like the ankle just can't find the ground where it belongs. And we'll demonstrate gait a little bit later. She is very rigid with her gait. There is a distinct lack of transverse plane mobility, a distinct lack of valgus in the subtalar joint. And of course we have the camera base here, the tripod here, that's interfering a bit. I'm just trying my best to get a clear picture here. Surprisingly, she has normative dorsiflexion on both sides. Good strength, except when we test perineals, a grade 4/5. This is someone who's very active, very strong throughout. But what we do find is that on the left forefoot, she has good mobility. Okay, the navicular can pronate, that can rotate medially. Okay, the subtalar joint on the left has a little bit of valgus motion, eversion, and if I rotate, you can see that there is abduction. And if I really block up here, okay, I block the lower leg, she still has motion there. And if I squeeze the malleoli so that we're isolating only subtalar, you can see that she abducts at least 10 degrees. And eversion, you can see that she gains a little bit there. On this side, if I only stabilize the lower leg, I'm pushing into the calcaneus, trying to get some valgus, and there's none available. If I grab the back of the heel, I am trying to twist it into abduction, so the forefoot should move laterally, towards the 5th toe. Nothing. There's no give there. If I clasp the navicula and try to medially rotate it, that is all that I can get. This midfoot is so rigid. And if I capture the cuboid and evaluate cuboid mobility, there's very little give at all. And if I spring the lateral malleoli posteriorly, no give. And if I try to spring it forward, there's no give. On this side, I can take up whatever slack there's available, and there's a little bit of play, small amount, and that's how it should be. And in terms of coming anteriorly, if I take up the slack and impart a little force, there's at least a little tiny bit of spring end feel. Not a lot, but there is supposed to be normatively a small amount. This fibular head, if I take up the slack through that, it yields, and if I spring it, it springs. Very strong joints. On this fibular head, I cannot take up the slack. It's just not possible. There is no give there. Let's have you lie on your stomach with your feet off the edge, please. And scoot down. Yeah, perfect. Okay. So she's lying quite symmetrically. The fibular head is very prominent on this side. On the left, if I take up the slack there and then spring, there is some give, a normative physiological give. On the right side, it's just not possible. I can't take up the slack. I'm tripling the amount of force that I'm putting in there, and there's no give. So now we'll look again. And her resting posture, these are in the same plane. So her left foot is in a little bit of varus. Sorry. Her left forefoot is in a little bit of valgus. This is her rest position. And you can see that her right forefoot is obviously in varus because these are basically parallel. Okay? On the left, stabilize here, she has a little bit of valgus. If I twist the heel, you can see the forefoot and the heel even. Look at the heel. Look at the amount of movement in that heel. On the affected side, there's no abduction at all. None. If I grab the heel and attempt to abduct the foot, you might have seen 3 to 5 degrees. If you look at the outside border of that forefoot, I can't take it any further. So she most certainly is living in varus, in the right lower extremity. Another way of saying that is that she has a supinatory fixation in the right foot and ankle, and it involves the subtalar joint, and it involves the cuboid and the navicular and the cuneiforms in between follow along that pattern. We did look at plantar flexion, dorsiflexion. That's full. She has full sagittal plane motion, but she has a significant reduction in transverse plane mobility, and we are going to go to work shortly. I do need to screen hip and pelvis, but I am very confident that if we treat the superior tib-fib joint and we treat all the major joints in the foot and ankle, I think that we can improve this. So I'm going to stop filming here, and we will come back and film the effective treatment in less than a half hour.